interest. Okay. So hope we'll be having that Shraddha and interest. May the blessings of Gurus be with us when we are discussing a very relevant topic. Jwara, that to Kriya Krama in Jwara. So I think I'll share the screen. Okay. Is the screen visible now?
Yes, ma'am.
Yeah. Okay. So, very relevant topic of day. I think the very idea of discussing Jwara in its various aspects was definitely a needed thing, because what all perspectives, whether any Samhita we could see Jwara Chikitsa to be said first. In Ashtangradayam after Sarvaroga Nidanam, in Charaka after Asayana Vajikaranam, Chikitsitam starts with Jwara. There are many reasons for the same, and in this context, understanding Kriya Krama in Jwara, which actually is the launch pad to all procedures, because we always say when it is the so-called what do you call it as Samprapti analysis at any stage. What is most important is we can think of the Samprapti of Jwara to be almost the beginning of any particular disease. There is no doubt about it. When we move on system-wise itself, see, there are conditions like Guillain-Barré syndrome, transverse myelitis, etc., which definitely starts with what you call it as clinical presentation of Santapa, Svedavaroda, Angagraha, etc. So definitely, even dealing with neurological clinical presentation also has got a clear relation with Jwara. We could see many kushtas having this kind of Jwara Samprapti in the background. Patients say, I feel heat, feverish in the night. Many Madhyama Roga Marga diseases like rheumatoid arthritis, etc., presenting with the same thing. Many gynec issues presenting with the same things, because when we deal with cases and I try to understand, there are cases when even fibroid uterus, initial case, we'll be able to manage or reduce the clinical presentation of the patient, starting with Amrutotram and Shatharanam. In hypothyroidism, we are able to give Amrutotram and Shatharanam. In diabetes, we are able to give Amrutotram and Shatharanam. So all those Santarpanotthajanya Vyadis, the whole spectrum, what all Acharyas has mentioned, definitely has got Jwara Samprapti in its background. So in this particular day or in this time period, when we are discussing or we are facing at least 60 to 70% of our OPD cases will be having some or the other relation with any of the non-communicable diseases like diabetes, hypertension, metabolic syndrome, PCOD, hypothyroidism, etc. All the Santarpanotha Nidanas becoming apart. The relevance of understanding Jwara becomes more, what do you call it as, important in that background. Now, directly into the topic, what I'm going to deal, I'm so sure that for the last many sessions, you have been dealing with, rather you have been going through the Samprapti of Jwara, understanding Nidana, etc., etc. So my area will be exclusively related to the Kriya Krama in Jwara. How can we understand the utilization of Kriya in a particular avastha, and how that actually gives us a guideline for the use of Kriya Krama in any avastha of a disease. So I think in that way, we will move on. So an introduction, my contents would be an introduction into the terrain of Jwara and a journey through the principles of clinical applications of Snehana, Svedana, Vamana, Virechana, Bar, Sramsana, Niruha and Anuvasana. Bahimari Marjana, of course, I'm also touching that area. So exclusively when a patient is coming to us, and how to apply this Kriya Krama in the Avastha, what are all the things that we need to analyze. I think it is this point that I would like to discuss with you. So I would like to go on with the session for almost 1 hour 15 to 20 minutes. Later, I would expect some questions, discussions from you. Okay. So, an attempt to traverse a vast terrain to use guiding principles in clinical practice. Because when Acharya speaks about Trishotyam Adhyayam in Charaka Sutra, and then again, as I mentioned, Jwara Chikitsa after Sarvaroga Nidanam, all this points out Shofa and Jwara to be two different spectrums, which, according to the Nidana and the affinity to Rogamarga, can lead to any kind of manifestation. Jwara, when it starts, if the patient has got its sthana samshraya in the Madhyama Rogamarga, can become a Amavata or a Vadrakta in later stages. If he has got sthana samshraya in Bahya Rogamarga, it can lead to some kind of Kushta. If it has got sthana samshraya in the Abhyantara Rogamarga, it can become some relation with the so-called spectrum of Vidhari, Gulma, Arsha, Grahani. Because in all these chapters, when you understand, or let's just look at through the Nidana and Lakshanas, you could find Jwara somewhere or the other. There is no doubt about it. So Jwara can be applied at a samprapti of any of the disease. So as I mentioned, Jwara is the initial samprapti of most of the clinical manifestations. And according to Hetu of the Madhyama Roga, Hetu and the Sthana Samshraya, definitely Nidana Vaishishtyam will lead to the so-called Samprapti Visheshata too. Because what kind of Nidana, that Nidana has got an affinity towards a clinical presentation, so definitely that becomes when Raktapitam in space specifically speaks about Brishada, Hoshna, Kodrava, etc. Then Raktaputta's possibility is more. When Vidahyanam Viruddham cha Tacha Asruk Pradukshanam. When Vidahi and Viruddhanam together comes out, Patrakta specificity is more. Mityahara along with Mitya Vihara come together, Kushta specificity is more. So Ketu has got specificity towards the Lakshanas, of course, depending upon the possibility of which Srotadushti is happening in the patient or already happened in the patient. So let me say, I would let us go on to our OPD. What I was thinking to discuss was, any disease or I feel any clinical situation when we need to discuss, you cannot, at least at this point of time, you cannot discuss it whole, that you have the whole knowledge of that particular area. I don't come under that category. I do realize that my knowledge in that any area is very limited, because more and more we try to understand and know, we realize that more and more we know very less and less and less. So what I'm trying to do in the next 1 hour is, I'll be discussing with you all what is my experience, what is my clinical experience, and how I am doing it within my limited understanding. Okay, and I'm sure that everything is perfect on my part or perfect output. No, it's a journey, right? Even at 60 or 70, also maybe the same thing. We'll be learning more and more. So till the last few years of clinical experience and observations, I'll be discussing only those things that is under my experience and my observation with you all. Okay. So let us see a female patient, 45-year-old, presenting with neck pain, low back pain. Okay. She's like nearing menopause. Most of the patients, in that category, little plumpy and all, they come and tell you, doctor, I have this night, I feel too much of cold. Night, I feel very, what do you call it as, I feel feverish. I feel like to have blanket or something like that. Okay. So you could see Jwara in that perspective. Okay. And in that condition, you need not go for Asana Saptagam also initially. You can just go for Dashmula Kadutrayam in the initial, or Shadharanam Guliga along with Amrutotram Kashayam or Sudarshanam Guliga. Because if there is Ama in the initial stage, Ama Pachana itself will relieve neck pain or some local Valuka Speda and all, neck pain and low back pain. Okay. Another male patient at 55-year-old presenting with weakness of bilateral lower limb, 5 months history, and he has got numbness of bilateral lower lip, and his issue started with urinary incontinence. Now he is having urinary incontinence, and when we ask histories, he had Sudden problem with the outpouring of urine. One day his urine got blocked over a period. Within hours, both lower limbs weakness persisted. He was taken to a hospital. He had a history of a fever like 1 week back. So it was a case of transverse myelitis. Okay, so transverse myelitis with the background of some viral fever somewhere, it had presented to be this way. So even in that case, I could observe Jwara to be in the culprit perspective when we assess the previous history of the patient. Hello, am I audible?
Yes, ma'am, you're audible, ma'am.
Okay, fine. Okay. So next is the case of 25-year-old female who was actually on Tylenol. She was an engineering college student. He had come with her weight gain and irregular periods. So I had actually asked her to undergo UST. So she had PCOD bilateral, but she was already on Tylenol for last 6 months. An 18-year-old female patient with chronic rhinitis, breathlessness continuously for 3 to 4 years. Breathlessness happens during the summer seasons. During the winter seasons generally. Otherwise, every day morning he has got venous. In all these cases, I could see the Jwara Samprapti in the initial stage itself. Okay. So let us see whether it was the case of the PCOD background weight gain, the male patient with allergic rhinitis in the background, the penisum spectrum, the previous neck pain, low back pain, the musculoskeletal issues, the neurological system like the weakness, etc. In that case, all the spectrum has got Jwaram in the background. So that we have, Jwara Samprapti in the background. Okay, so let us think how are we going to treat these cases? How can we select different Kriya Kramas? All the guidelines that has been given by Charakacharya or Ashtanga Susradam helps us to understand whether we can go for any which Kriya Krama. So we'll be discussing that. So directly, see, we know when it is Ama, now naturally Langhana, when it is Ama in the sense Santarpanottha Vyadi, we generally has got Dvividopakramaniyam. When Acharya has spoken about Doshadi Vijnaniyam, Doshabhediyam, Doshopakramaniyam, followed by Dvividopakramaniyam, he speaks, Langana Brahmaniyam and Charaka, Dvividopakramaniyam and Ashtanga and Sangraham. First point as a clinician we need to understand is whether the disease is Santarpanottha Vyadi or Apatarpanottha Vyadi. So if it is Santarpanottha Vyadi, definitely the first thing is Langana. As you all know, text he divides it into Shamana and Shodhana. Shamana again 7 types: Shutrat, Atapa, Vyayama, Marute, etc. So that becomes the Shamana spectrum. Shodhana spectrum, as you all know, Kaya, Shiro, Reko, Asra, Visruti, the spectrum, Vamana, Virej, Namasti, Nasyam, etc. So Langhanam can be done. Which Langhana we will discuss later. Whether to do Langhana to a patient. So he says, Jware Langhanam eva adau upadishtam. Okay. Rute Jwarat, except in that category. Which category? He gives us caution. If you could find the Jwara in the background of Kshaya, Anila, Baya, Krodha, Kama, Shoka, Shramodhavad, don't go for Langhana. For example, I have a female patient, okay. She is 70 plus. She had come to me. Now she says, I am having fever for doctor for last so many days. Now more than 3 weeks I'm having fever. Now when I inquire, she says I'm now having weight loss. For last 2 to 3 months I've lost I think 5 to 6 kgs. Then when I inquire about the bowel movements and all, she speaks about I have that pellet-like things coming up. I feel something obstructed. Sometimes it comes out. Sometimes I have loose bowels. So this altered bowel habit, weight loss, feverishness. So what should I make? 70 plus female OD, female patient. So some Samprapti or pathology in the background that can have some Antarvidhradi kind of presentation. Some carcinoma in the background is a possibility. So when Kshaya, Anila, Bhaya, Krodha, Kama, Shoka, Shrama is found to be Nidana of a particular category of Jwara, there you don't go for Langanam. He gives us a guideline. But in all other cases, you can go for Langanam. Now what is Langanam? As I mentioned, Shamana and Shodhana. So Shamana and Shodhana. So what are the Shamana method of Langanam? Acharya speaks about he has already given us guideline in the Langana Brahmaniyam Adhyayam. Shutta, Trita, Vyayama, Atapa, Maruta, etc. are the Langanas. Now the Shodhana, Charaka speaks about Chaturveda Samshodhana. Ashtanga Hridayam speaks of Pancha Shodhana. Vamanam, Virejanam. So, Vamana, Niruha, Kaya, Shiroreko, Asra Visradi. So naturally, the kind of spectrum of five this has come up. So if he's speaking about Langanam, except in these cases, we have to go for Shamana or Shodhana. We will see how we will go for Shamana or Shodhana. So let us keep the 4 cases in the background. The lady with the PCOD, the male patient with all that sneezing, etc. and the other female patient with neck pain and low back pain, and the male patient with the other. So let us keep these 4 cases in the background and try to analyze the Kriya Krama. Okay. So if a patient is coming, I have seen cases wherein, this evening feverishness has come down by giving Kalyanakam Kashayam. I had a case who was having this evening feverishness. She was 45-year-old female. She is losing weight. She does not feel like sleepy, etc. On inquiry, it was after her mother's death that she had an issue. So there I think of Langanam, no, because I could understand it was this Jwara in the background of Anila Kopa, Bhaya, etc. So there definitely Kalyanakam Kashayam followed by Indukandam Gurutam or Kalyanakam Gurutam was the medicine that I had given and responded. In that stage, I don't think if I think of Vetumaran, Lakshmi Vilas Rasam or Sudarshanam, that would respond. No. So that is the understanding primarily we have to thinking about the Langanam. So Langanam, so then other next principle by Charaka. In Taruna Jwara, what he says, Langanam, Svedanam, Talo, Yavaguhu Tiktarasaha, Pachanani Avipakwanam, Doshanam Taruna Jware. So he gives us an idea. In Taruna Jwara, what are all the possibilities that you can go for? Langanam, Svedo, Kala, wait for Kala, Yavagu, Tiktarasa, Pachana can be done, Avipakwanam, Doshanam, Taruna Jware. So naturally, see, the case that I have told about myofasciitis in female or the hypothyroidism background, in acute cases with history of 3 to 4 months, I would say. Okay, not for a long-term history, but in acute case of 3 to 4 months history, definitely this kind of what you call it as Taruna Jwara, the treatment that Acharya has asked us to go for, in the background of Taruna Jwara, you can select them. So Langanam can be given, Svedanam can be given, Yavagus can be. I had a case wherein this kind of feverishness is persisting in the background, but the patient's presentation is actually IBS. Okay, but whenever he has food, actually he goes like want to go to the toilet. This has started from 2 years, and I had initially given Kalashakadi Kashayam. He was with Vilvadi Gutika. He has started responding positively, but still that feverishness was persisting. Then I had given actually Yavagu. Okay, Yavagu with a little bit of Haritra and Panchakolam. Okay, Panchakolam, because Panchakolam was given to improve Agni, even though it is Tikshna, it may add on. So I had added Haridra and this thing. So, and the thing was Tikta Rasam adding. In that perspective, Tikta Rasa, Guduji was found to be one of the dravya which I commonly use in many of this Samprapti. Whether it is skin or Madhyama Roga Marga, whenever I could find Pittadikyam in the background in the, or what you call it as Samprapti, Tikta Rasa Guruji is only used as such. So Tikta Pachanam, Katu Pachanam we have. When Pitta is in the background, we go for Tikta Pachanam, Guduji Adiganam, Manjishta, Guduji, etc. And Katu Pachanam, we use Trikadu, etc. Pippali, Maricham, etc. in the background. So even in myofasciitis of females, the neck pain, low back pain, which usually patients come and speak about, and the hypothyroidism spectrum also, this can be understood. Now, as I mentioned, let us think of the initial phase of any of the clinical condition, like any clinical condition. Like if it is like almost 1 to 2 or 3 months in the background, a systemic issue, okay, not just he had fallen, he had pain here and there, but systemic issue. So Acharya gives us direct reference, Trishyate salilam cha ushnam vadakafa jware datyad मध्योते पैतिके चाधय शीतलं तिक्तकैः श्रुतम् दीपनं पाचनं चैव ज्वरघ्नम् उभयं हि तत् स्रोतसां शोधनं बल्यं रुचिस्वेदकरं शिवम्. So he speaks about the importance of salilam cha ushnam. In all vada vatakafa jwara, go for ushna salila. Why? Deepanam pajanam cheva jwaragnam srotasam shodhanam balyam ruchi svedakaram shivam. So see what importance of what you call it as this ushnodaka pana itself is there. So in vatakafa you can go for ushnodaka. In paitika madhyote paitike cha atha sheetalaha shiktakaihi srutam. You can use any tiktaka dravyam processed but can be sheeta. As I mentioned, it is tikta pachana. So you can go for guduchi adi panagam or only guduchi panagam, which is one of the, you know, it like rakta prasadhanam in the background, which is a wonderful drug in this all spectrum of, you know, jwara wherein we could see these things. So two things when we are moving on in the initial phase. When we see there is vata kapha in any samprapti with pain, stiffness, etc., ushnodakam has to be given. If there is pitta in the initial phase, tikta, shrita, sheeta, jala can be given. So it is in that perspective, like langhanam, svedanam, kalo, yavagu, tiktaga, rasaha, pajanani, avipakwani. So that pachana can be done by ushna jala and the so-called possibility of tikta jala when it is pitta in the background. So that can, so you know, you just tell the patient to have hot water. I'll tell you the results will be there within 3 to 4 days. A little sip of hot water only. The females have a habit of having this water from the fridge directly. Okay, so you just advise the patient to have this one. That will support to a great extent. Now let us see the specific avastha wherein Acharya speaks of using snehapana. This, you know, this we can use in toto. If a patient comes to me and I think I have to introduce a sneha to the patient, whether he is indicated for that or not. Like I want to have a knee joint pain patient, I want to stabilize. I know there is vata kapha, vata plus in the background, there is astikshaya, etc. So what can I go? What is the medicine? I want to go for a ghritam. Why ghritam? Ghritam is vata pitta hara. Tikta kshira and tikta ghrita has got special affinity to asti dravyas. So that's snehana that I would like to introduce. You know, when we want to introduce a snehana can be in the form of all pravara snehas, whether it is ghrita, taila, vasa, majja. But ghrita, taila we know where it can be used. Grandhi, nadi, krimishleshma, medo, maruta, rogishu. Tailam, lagavadharge, arti, krura, koshtishu, dehishu. So it is this spectrum of people on whom we can use tailam as snehana. Ghritam can be used in all ghritam, dhi, thridi, medadi, kamshini, all higher mental function. And in all cases wherein we need vata pitta haratvam. So see, he specifically speaks of kafe mande, vada vittotare, paripakveshi dosheshu, sarpishpanam, yatha amritam. So any snehapana or any situation wherein I need to introduce snehana is vada pittottara avastha and manda kapha avastha is must. Now this directly cannot be related with Shodhananga Snehapana. It is for Shamana Snehapana. Shodhananga Snehapana, definitely we need to go for Utklishta Avastha, Mandaka Bhatvam, but even there, Manda Kabhatvam has to be a criteria. That is what he indicates, because very high avastha of kapha it is there. You need not go for snehana. For example, tatrutklishte samutklishte kaphapraye chale made. That is the situation. You can directly make the patient undergo vamana if it is Shodhananga Snehapana. So even in Shodhananga Snehapana, but not as important this thing is as for Shamana Snehapana, wherein Vata Pitta has to be the important criteria, and Vata Pittottere Kabhe Mande. So Athaudva Kabhe Mande Vata Pittottere Jware. So if at all I have to think of giving Indukantam Gratam, Pittagam Gratam, Amrita Prashya Gratam, Sukumaran Gratam to anyone, this situation in general I need to think of Vata Pitta Uttara and Kapha Mandavastha. So that is this, this can be applied in any clinical condition, any disease that Acharya has told about. Now, how in a clinical scenario, we are dealing with patients basically. And we know it is like Tridoshas, Saptadhatus. Okay. So this combination of Tridoshas, Saptadhatu in different, what you call it as, different permutations and combinations give rise to different dosha sammurchanam, resulting in different sampraptis. So how will we analyze what you call it as how much is the dosha dushti, and whether can we go for a Shodhananga Snehapana or Shamana Snehapana, or should we go for a Shodhana? Acharya in Upakalpaniyam Adhyayam and Langana Brahmaniyam Adhyayam, he has given a guideline. Okay, Bahu Doshavastha, Avipakwanam, Alasyam, Avipakwanam, Gauravam, Stambhaha, all these things, Lakshanas, wherein you could analyze whether the patient is in Bahudoshavastha or not. Okay. But some clinical guideline, this has been specifically mentioned by Ashtanga Hridaya commentary. Below that, Yadavji Trikamji commentary book is there, no? Doshadi Vijnaniyam. This is clinically very relevant. Now, when a patient comes to me, it is important that I have to primarily understand whether it is Samavatam, Samapittam, Samakafam, or Niramavatam, Niramapittam, Niramakafam. When we are treating also, our understanding or our target is to move from Samavata to Niramavata. That is our target, yes or no? So we have to analyze that as such. From Samavata to what we call it as Niramavata, we need to move from Samapitta to Niramapitta, from Samakapha to Niramakapha. So these Lakshanas need not just, keeping these points in mind itself would be helping us. So Nirama dosha, Nirama vata is Nirama, Vishado ruksho, Nirvibando alpa vedana. So when vata is moving nirvibanda, there is no problem with vatanulomana, which can be understood in the format of Mala Mutra Purisha Pravartanam. Okay, so Mutra Purisha Pravartanam indicates vatanulomana, and the vedana is alpa. So vata is Niramavastha, had become Niramavastha. In Pitta, Atamra Pitam, Atyushtam, Rase, Katukam Asthiram, Pakvam, Vigandhi Vigneyam, Ruchi Pakti Valapradam. See, Pittam from Ama to Nirama, Atyushnam Rase, Katukam Asthiram, it becomes Asthiram, Katukam. Okay. Pakvam Vigandhi, the Daurgandhya smell will be moving to Vigandhi Vigneyam, and you will have Ruchi Pakti Balaprada. Atamra Pitam, the color which is something which is very Arunabham, etc., will be becoming Atamra Pitam. From the Ushna Gunas less Avastha, it becomes more Atyushna. From more of Amla Rasa, etc., in the Sama, which will be taking, Tatu Rasa will be happening. To move on, it will be more of Asthira, but it will be Vigandhi. So this is Nirama Pitta. Nirama Kafam, Fenavan Pinditaha Pandu Nissaro Gandha Evacha, Pakvasa Eva Vigneya, Chedavan Vaktra Shuddhikritta. Like if somebody is having kapha in the background, lot of, but this kapha I had treated, and kapha has started coming out like little out. Okay, so that indicates it has become Chedavatvam. So the Samavastha to Niramavastha movement, it has come up. Okay, will be with Chenam, it becomes more Pindi Bhavatvam. It will be Nissara, it will be happening. Gandha will be there, but this is the indication. So it is not the Kapha has completely moved on. With our intervention from Sama to Nirama, it has come up. Now see, Sama Avastha, what Acharya has given, Vayo, Samo, Vibandha, Tandra, Antra Pujanam, Vedana, Shofa, Nistoda, Kramasho, Angani, Pidhayed. There will be severe pain all over the body. Vicharayed, Yugapachapi, Grahnati, Kupito, Brisham, Sneha, Dehi, Vriddhi Mayati, Surya, Megodaye, Nishi. So when Sneha will be given, it will be increased. When Surya Meghodaye Nishi. So when there is Megha Udayam, it will be increased. When there is Nishi, it will be increased. It will be with lot of pain. But Nirama Avastha, let us see how it will be moving on. It will be, as I mentioned, the previous one. Niramo Visha can be taken. Why I am telling this is a guide. This is, I think, one of the clinical guideline wherein any disease it comes with the background of samprapti of jwara or otherwise. These lakshanas can help us to understand whether moving in the right direction with respect to treatment or what. Now, Sama Pitta, Durgandam, Haritam, Shyamam. Okay, Pittam, Amlam, Stiram, Guru. As I mentioned, when we move to Nirama Avastha, there is no Gandha. The color from Amla Rasa, it becomes Katu. And then Haritam Shamam, it becomes Atamram. Amlika Kantahrit Daha Haram Samam. That is not there. Kantha Shuddhi is there. So that is moving from Sama Pitta to Nirama Pitta. And then Sama Kapha Avilas Tandulas Sthana. Sthana means it will be very sticky. From there, what is the Nirama Avastha of Kapha? It is Chedanavan. It gets removed. Sthana Kanta Deshe Avadishtade. Samo Balaso Durgandhi Kshut Udgara Vighatakrit. So it creates Vighata to Kshut and Udgara. If you don't have Udgara properly, it indicates there is more of Kapha. It is, of course, Durgandhi. When it moves to Nirama, it is not as Durgandhi as before. So these are so our target of any of our Kriyakrama, whether Langhanam, Shodhanam, etc., it is to move from Sama Dosha to Nirama Avastha. That we have to understand. Okay. So let us see in this background, as I clinically, as I mentioned, whether we have to introduce Gugulu Tikta or Tikta, we, in the practice, whenever we practice, there are all traditional Vaidyas in Kerala, and once upon a time, their practice was you start with Kashayam and end the treatment with Gritam. Okay. Because with the Gritam, Gritam is actually what it is a part of Nityam Kshira Gritabhyaso. It is a Rasayana. So once you start, you give medicines 3 weeks or 6 weeks, and then the recurrence, etc., will be very less or very almost, nil as such. So only once we stop with Gritam, it indicates here, because Sneha is actually Sneha Saro Ayam Purushaha. It is the most Satmya Bhava to the body as such, As the Mahadevan sir always says, life is actually a journey from Ushna Snigdha to actually Ruksha Shita. Okay, so when to introduce Gugulu? If I'm having a knee joint pain, severe pain, I definitely need to end my treatment with introducing a Grita or so that the patient can continue. Because otherwise, this Hastikshaya won't be supportive, and the so-called Vatakopa will be continuing to have pain. So when to introduce Gugulu Tiktaka Grita or Tiktaka Grita? In numbness cases, we usually start with Amrutotram or Sahajradi Kashayam. And towards the end, we actually go for Sevya Tailas. Sahajradi Sevya Taila, Dhanvantara Sevya Taila, Madhvi Ashtiyadi Sevya Taila. So all these things indicates the avastha wherein we can introduce. What is that? It is actually Vata Pittotara Avastha, Kapha Mande Avastha. And for that, the guidelines can be, we need to analyze whether the Vata Pitta Kapha is in Samavastha or Niramavastha. In Niramavastha, Vata Pittotara Kaphe Mande, definitely introduction of the Sneha has to be given in any of the case that comes. So this guideline in Jwara Chikitsa we could see. Okay. Then moving on to Sweda. In any case, should I make the patient undergo Sweda? If I admit a case, should I think of going for Sweda? So definitely we will be thinking of contraindication and indication in the primarily. But the avastha wherein Acharya has specifically told about Sweda, Sauddarta, Pinasa, Shvasa, Jangha Parva Asti Shulini, Vatashleishmatmake, Sweda Prashasta Sa Pravartayet. So two things he has given us. He has given us dosha dominance, Vata Shleshmatmake. Then what is the clinical indications? Vata Shleshmatmaka. It will be presenting with, of course, Jangha Shula, Parva Shula, Asti Shula. So whenever there is Parva Shula, joint pain, whenever there is Asti Shula, some bone pain, whenever there is Jangha Shula, probably a muscular pain in the thigh area or more of muscular longitudinal muscle pain, whenever there is Shwasa, difficulty in breathing or any difficulty in Pranavayu Sanchara, Pinasa, blocked Urdhva Jatrugata areas, not only just rhinitis, you feel blocked. So, any skin possible is a possibility. He speaks about Sa Uddharta, not any other. Kushta is generally contraindicated for Svedana. Uddharta is a clinical situation which manifests because of Vadakatmatva in the background. Okay, so naturally, in that perspective, say Sveda can be done. Acharya tells this in Jwara, but you could see in all these. So, if my prescription of OPD level, okay, if it has to have a kashayam or a tablet, should my prescription have any of the Kriya Krama? Definitely we must have, because Kriya Krama is the greatest weapon. You can ask the patient to try for some local Sveda if there is joint pain. We usually, we ask them to have some Kulatha Svedam, Baluka Svedam, or local Tunikiri or Vasa Svedam. You just have to wrap the, what you call it as, cotton cloth and then make it into a potli and heat it in that area. Okay. So that has to be a possibility when we are thinking of in the background of any of the clinical situation. So I repeat, Svedana can be introduced one. Any case, Jangha Parva Asti Shuli is there. Pinasa Shvasa is there. Vata Kapha in the background. So this is the thing. Okay. So in the clinical situation, as I mentioned, we use Valuka Svedam, Vasa Svedam, as I mentioned, Tunikiri, Tusha. Tusha is, Tavida, the rice bran. Once after the rice is actually taken out, the bran of rice will be there. It's actually very, we have rice bran oil and all, that's available in rice mills. It is very good one for having what we call it as local Sveda. We could see Karisha Sikatatu Shehi told for Sveda Dravyas in Charaka. Any both, all speaks about Karisha Sikatatu Shehi, etc. So, in the OPD, we can use these things in the Avastha. Okay, as I mentioned, Sveda comes under Langana, the first principle, Kshaya, Anila, Bhaya, Krodha, etc. has to be excluded as Nidana in the Samprapti so that we can go for Langana. Now, the important aspect of Vamana. See, Vamana as a procedure, we go for Vasantika Vamanas for Swastha. We go for Vamana in Prameha, in PCOD, in Sthula, in psychiatric issues, in Kushta. In all cases, we go for Vamana. Why Vamana? Kabhottaravastha. What? Navajwara, Atisara, Adapittasta, Rajayakshminaha, Kushtameha, Apachi Grandhi, Shlipada Unmas, Akasinaha, Sanya Dosha, Urdha Roginaha. So, the spectrum is there for us to understand Vamana is indicated in these spectrum of diseases. But whether Vamana can be done in that avastha or not, Acharya Charaka gives us the guideline. In Jwara Chikitsa, Kabha Pradhana, Anutklishtan, Doshan, Amashayasthitan Budva Jwarakaran Kale, Vamyanam Vamanehi Haret. Vamyanam Vamanehi Haret. That point is important. Like if the patient is indicated for Vamana, Vamyanam, those who can undergo Vamana, If he make him undergo Vamana, that disease will be haret, removed. But what is that avastha? Doshanam amashaya sthitan, kabha pradhanan utklishtan. So kabha pradhanatvam utklishtam plus amashaya sthitam. So this is the avastha where Vamana has to be done. So when we are actually going for even another scenario with Shodhananga Snehapana and intending to go for Vamana, Amashaya Sthitan is important. So Chakrapani there gives us again guideline. What is Utklishtan? Kafa Pradhanan Utklishtan. Utklishtan iti Prillasadi. So Prillasadina Bahihi Gamunon Mukhan. आमाशयस्थितान् नित्येन सर्वशरीरं परित्यज्य आमाशयगमनं दर्शयति. So it is clinical guideline, you know. Utklishtan in the sense Hrillasadihi, Bahigamanonmukhan. So Hrillasadi with the lakshanas like Hrillasadi, the kabha is Bahirgamanonmukhan, wanted to move out actually. If somebody of you have undergone Vamana, you could experience that. आमाशय स्थितान् नित्यनेन स्थितानि अनेन सर्वशरीरं परित्यज्य आमाशय गमन. आमाशय स्थिता in the sense what? The doshas after going for parityajanam from all over the body has to come to the amashaya darshayati. You will see darshayati. How we will see? The patient will feel. I have done myself Vamana. I have experienced it. What is that? You know, you could feel the heaviness in the stomach. You could see something has to. It is that avastha where Vamana has to undergo. So, thing is, we need to understand Kapha Pradhanan, Utklishtan, Amashaya Sthitan. How are we going to analyze whether Amashaya Sthiti has happened or not? Amashaya Sthitan, iti anena, sarva shariram parityajya, Amashaya Gamanam darshayati. So, from all over the body, amasha, you could feel, you know, something is in the stomach is increasing. Increasing in size, this we could definitely experience. So that is the avastha where Vamana has to be done. Ashtangahridayam speaks of these words. Tatra Ashtangahridayam Jwara Chikitsa. Tatra Utklishte Samutklishte Kafapraye Chale Male Sahillasa Praseka Annadvesha Kasa Vishujika Sadyo Uktasya Sanjate Jware Same Visheshata. So what he says, Vamanam Vamanarhasya Shastam. Vamana can be done to Vamanarha in what avastha? Utklishte, Samutklishte, Kafapraye, Chale Male. Mala has to be in Chalavastha. That will be indicated by which? Sahillasa Praseka Annadvesha Kasa Vishujika. Sadyo Bhuktasya Sanjate Jware Same Visheshata. So, in the Sahillasa Praseka, Annadvesha and Kasa Vishujika Sadyo Bhuktasya Sanjate. That Jwara which has happened because of Sadyo Bhukta. After having food, suddenly he has fever. You just ask him to vomit. That's enough. That will relieve. It is actually something related to the Rashashesha Ajirna, which can be relieved by Vamana. Okay. The Kasa Hillasa Praseka Annadvesha Kasa Vishujika. The Kasa Vitsa Hillasa Praseka. That indicates an avastha of Utklishta avastha, where it can be done. So Vamana avastha, in any case, you have to think of Sahillasa, Sapraseka, Annadvesha. These three things is a criteria for us to understand whether the avastha is Tatra Utklishta, Samutklishta. Okay. So I'll just share with you an experience of a female patient. Okay. She was Rashida. She was 30-year-old female patient coming with multi-joint pain and swelling for last 2 to 3 years continuously. So she was like having joint pain. She initially earlier used to have some allopathic drug which had but then her abdomen, there was severe stomach upset. She cannot have all those things. She had come to me. All this jwara, swelling had come up. So first time I had actually treated her with all Ruksha Svedas, like Dhanyamla Dhara, Kulatta Dhanyamla Sankara Sveda, something called as like that. And then, she had just 7 to 8 days, then she had to leave. So I just done this. And I've done an Ruksha Vasti with Amradotram Kasham and Vaishvanda Churna. That was some 8 months back. She was better. She got relieved of 60 to 70% of the issues. Then, after 6 to 7 months, she came back. She told doctor that pain and all had again come up because I had to do so much of work. There was stress, etc. And then, again it has come up like anything, doctor. Morning, I have severe issues again. There was some stress in life, etc. And all her joint had again swollen up. So she told, I have no issues. I'll stay as many long. I just want to completely get rid of this issue. So I had admitted her again. So I started with the same treatment, okay? Dhanyamla Dhara, Sankara Svedam, Churavinda Svedam. But this time her pain was not at all coming down. I mean, she was feeling better, but I'm not satisfactorily pain coming up or going off has not come up as such. So I was like worried. I mean, why this was happening? And suddenly one day after there was a discussion on Vamana in the background and all, and I was in a workshop wherein one Dr. Apastim from Maharashtra had communicated that in an avastha at any time you can do for Vamana. For me, doing Vamana was always like Kabhakale. Otherwise, how can we go for a Vamana? Even Sadhya Vamana in that avastha, Kabhakale has to be done. But then, when I was like, again, that day rounds, I could see her pain has not come down. And she was telling, I have this heaviness of chest. I'm salivating, doctor. I have this pain and all. And suddenly, this Hillasa Praseka, this was coming in my mind. I had made her undergo Sankara Svedam. I had made her undergo this thing, what you call it as Pudikiri, that is Churnavinda Svedam, Ruksha. Nothing, pain was decreasing, but she was not comfortable. Then, that avastha, I just asked, we will go for a Vamana today. No Kleshtam, nothing. There was no, but I thought, because the avastha is like that only. She was feeling heaviness. So I just asked nurse to prepare Yashti Madhu Pandam. Okay, it was 10 something. And when I went to the rounds, you just prepare. We will do what we can do. By 11:30, it was ready. And she was just made to come to the theatre and it was given. And she continuously had the same Vega, having Vyashtishi. And in every Vega, something or the other kapha was coming out. And after that, she was so relieved of her body heaviness. And then next day, I continued Dhanyamla Dhara. Then her pain had almost come to zero. What you call it as when we say VAS scale, so pain that was almost 9 or 8 when she came with Valuka Svedam going up in the initially it had come to almost 5 or 6 only. But Vamana I had done and then made her to undergo, it was Langanam, and then I had made her to undergo Svedanam. Her pain has come down to 0 or 1. So that avastha was actually indicated for Vamana. She was having this santapa, feverishness in the night and all. So there, if without understanding that, I continuously go on going for Sveda, thinking only Vata Kapha avastha, I have to understand the dosha sthiti is in Amashya. That kapha that is in the Amashya is actually causing the whole body issues. And unless and until I remove that Kamashyam and Kamasya is the kapha, there is no point in going for Ruksha Sveda externally, which was not enough to do Pachana to that kapha. So that was an experience which taught me a lot, because it's not that when all Vamana case, Amavada case or Amavastha of Adrakta, you can go for Svedana, it will be responding. No. Because in avasthas where Vamana has to be done, only that has to be done. Okay. Now, the only thing is we have to be precautious. Acharya gives us where Anupastita doshanam Vamanam Tarune Jvare Rudroga Shwasa Anaha Moham Cha Janayat Prasham. See, if you are doing Vamana in Anupastita dosha, Rudroga Shwasa Anaha Moham, he speaks unconsciousness, that is the okay. So even that is a possibility. So that avastha is very important. Now he speaks about anupastita dosha. I'll share one more case with you actually. it was the same period when I had done Vamana to Rashida, almost 3 weeks later. This girl was actually Rachel, 16-year-old. She was like 9th to 10th pass girl. Her basic presentation was severe neck pain and low back pain. Okay. So whenever she goes to the school and has bag in the back, she has pain. And her mother had told me, doctor, she is like not at all going to school book because of this. She had it was actually pre-COVID, initial state time period of COVID as such. Okay. So now anyway, classes are not there. So I had actually made her admit. First time I had done some external procedure. She was fine. I had gone to write exams. After 3 to 4 months again, the issue came up. She came back. So on some rounds, she had this neck pain coming up. It was not fully going. And then she had actually told me on rounds, doctor, now I feel like I don't have any, what you call it as, appetite. I just feel like vomit. Ullasam is there. I have itchy things all over the body sometimes. And then from today morning, I'm coughing. So I thought, oh, then, he is coughing and sneezing, okay? That pain. So I thought she's indicated for a Vamana. She's 16-year-old, but she's very lean girl. So she's 16 with all this Uddhata, Sapinasa, all Lakshanas is there. Okay, so we will go for Vamana. So I did not make her undergo any Snehapana or nothing. She was having this local neck, some layapam and all, and I was observing. So I just advised, we need not go for Snehapana. With all this thing, we will make her undergo Vamana, Yashti Fandap, we will give tomorrow morning. So I had gone rounds in the, I think, post afternoon. I had asked them to prepare by 6:30 morning. And that evening, I had given her some Masha Paisam. Okay, that's enough. Tomorrow we will go. And then I had made her undergo, morning 6:30 she came, I had made her undergo Yashti Fandap. She was having it and she was sitting. And there was no response, no Vegam. After 4 glasses, almost 1 liter, no Vegam, she was just sitting like that. And she started swelling, sweating, and she started having this giddiness. There was no Vegam. So I tried to give little more, like 1.5 liters. Her giddiness was increasing. She was unable to vomit. Nothing had come out. She was continuously sweating. I asked then, it was Ayoga, Apravati, just to tickle and vomit. She was tickling, but nothing was coming out. She was almost fainting. That was my great experience because she was a young girl. So her vitals, pulse was almost like feeble, but other vitals, BP was a little low, but she was otherwise stable. She was responding and all. Then, I was like thinking, I just stopped, will not give her anything else. Let her be calm. We just stopped medicine, giving 1.5 liters. Yashti Fanda was inside her. And I just asked her to have, like when she was fainting, I just asked to have some sugar. And she had it and she was otherwise stable, and we made her to go to the room. And I asked her whether I thought you will pass some loose bowels. She told nothing. I just passed 2 to 3 times urine only. No bowels. From next day, her Agni was so bad that she was never feeling like having food. She was having some go, but nothing was coming. Then, I could understand, the avastha was anupasthita basically. And her mother was telling, otherwise also, doctor, she is having very difficulty in vomiting, right? From the childhood, whenever something happens and others have vomiting, she does not vomit. She just has this burp and some gas comes out and she does not vomit. So, my understanding of that running, sneezing, some skin issues. Of course, there was Kapha Pitta Dushti in the background, but it was not indicated for Vamana at all. So that was the situation. So that avastha is very important. Now we will move on to next Kriyakrama for Virechana. Pittam va kapha pittam va pittashayagatam haret samsanam. So he gives us very specific. Pittam va kapha pittam va. But what is that? Pittashayagatam avastha has to be there. How we will understand Pittashayagatam or what? Samsanam. Treen malan haret, bastir haret, pakvashe sthita. So, amashe sthita vamana, pittashe sthita virechana, pakvashe sthita vasti. This is a guideline. But how will we understand whether the dosha has reached Pittashaya, whether the dosha has reached Pakvashaya, Amashayasta Lakshanas he has given us, Sauddarda Penasa, etc. Pakvashayagada dosha Lakshanas, Pakvashayagada Vada Lakshana Acharya has told us. We know Shulana, Hantra Pujanam and all. Pakvashayagada dosha Lakshanas, like Kapha Pitta, nowhere we could find. Poshtagada Kapha Pitta, he has told, not Pakvashayagada, because basically Pakvashaya is Thana to Vata. Maybe that's the reason. So he gives us Pittashim. So what is that? Chakrapani's commentary helps us. Virechana Astapanayoho dosha bhedena sthana bhedeshana cha vishayamaha pittam ityadi Pittashim amashe adobhava. So you could feel that heaviness of the abdomen in the lower area of the abdomen. Definitely it is indicated for Pittashim Virechana. That I have also experienced, that is always there. But Pakvashayagata dosha of kapha and pitta is never understood clinically. The only thing is when we have the samprapti below nabi, we can think of vasti for that particular patient. Of course, there is haratvam of 3 malas. Because there is kapha pitta nirharanam from vasti also, because kapha is actually niruha vasti's end point to it has in samyak lakshanas. But to analyze whether something has reached kapha pitta in the pakvashaya, there is no clinical understanding. But ado amashayas pittashaya, it is there. So pitta dushti or kapha pitta dushti with this pittashaya gatam, that is indicated for virechana. Now again, I'll just share one of my experience with the psoriasis case, wherein I had given medicine for the patient on the first day for virechana. He had so much of, like, he was from Karnataka, there was no communication. He knew only Kannada. We never knew Kannada. So he even didn't knew Hindi or English. So, but anyway, some communication was happening. I had given Patola Katirohinadi with Virechana with as Satya Virechana, because he was having severe itching when he came to us. Severe itching, horrible itching. But Vamana was not, I was not, like, I didn't, communication was difficult. So I had first given Virechana. So he had told for loose bowels and something had gone also, he had told as such. But when we did Vamana to him, his Pittandam had not come, because I was expecting a Pittandam. Then that patient has told me, there was a doctor who had done his PG from Karnataka, so we had arranged him to talk to him. Then he told on the first day when they give medicine, I had vomited many times also along with loose bowels, and on vomiting I just had some yellowish fluid coming out, which was very this thing in taste, bitter in taste. So he was having pitta coming out even when we gave her Virechana Aushadha. Of course, because why kapha, when avastha of kapha is very high, Virechana Aushadha becomes Vamana, will cause Vamana as such. So that was not an indication for so-called giving Virechana, but it was actually indicated for Vamana. So Virechanam has to be done when Pittashaya Gatatvam, that is seeing of doshas in the Athonavi. So on the day of giving Virechana, we can see when we are assessing Pitta or Kapha Pitta Dushti in the background, on the day of Virechana, we can ask the patient whether you are feeling some heaviness in the lower abdominal area. And in that avastha only, we can give Sneha Sveda and the Virechana Aushadha. Okay. So as I mentioned, Pitta and Pittashaya, Kapha Pitta and Pittashaya, how to identify, and Vagbhata speaks about Pakvashayagatam. So that is the placement, the possible identification is the only these Lakshanas that we could see. Otherwise, there is no direct reference. Now let us see Niruha's placement. As I mentioned, Treen Mala Niruhaihi Jayet. But there is one avastha where Acharya specifically mentions about Jwarakshiyanasya na hitam vamanam na rechanam. A patient who is already kshina with jwara, vamana or rechana cannot be done. Kamam tu payasatasya niruhaihi va hare mala. In that avastha, payas can be used for Niruha, because when there is Agni root is very low, the rectal root is the best root. That is why we have, there are so many types of Vasti, right? Why Vasti is called as Ardha Chikitsa? You can think of only Langana through Vamana or Videsna. But through Niruha, you can go for Brahmana Kshiravasti. You can go for Langana Vaitarana Vasti. You can go for Lekana Vasti. You can go for Rasayana Madhutailika Vasti. So the mode of action of Niruha is actually immense. To a great extent, it is very, very, very high as such. Okay. So hence, Niruha can be practiced Balam, Agnicha, Vijwaratva Mudam Ruchi, Paripakveshu Dosheshu Prayuktaha. Paripakva doshas. But the patient is not indicated for Vamana or Videsna because of Jwarakshinatvam. In that case, Niruha is the best option. So this can be applied in any case. If we have what you call it as low backache, you want to make her undergo Videsna, but because of his chronicity, etc., his Kshina Avastha, Vasti can be a choice. There is no doubt about it. So it is this principle that we are using in patients of Guillain-Barré syndrome when they come about with general weakness, loss of appetite. Kshiravasti Prayoga in small dose has found to be effective in the initial stage itself as such. And the avastha of Anuvasana Vasti. This you can apply in any case. The common low backache, knee joint pain, ankle pain, and the common spectrum that usually approaches an Ayurveda physician. Jware Purane Samkshine Kafapitte but Dridagne Rukshabadha Purishaya Pradadyad Anuvasanam. So Samkshina Kafapitta Avastha has to be there. At the same time, Dridagni has to be there. In that Avastha, if there is Rukshabadha Purisha, Anuvasanam can be begun. Ashtanga Sangraha gives us a little more. Prakshina Kafapittasya Trika Prishta Katigrahe. Deeptagne Baddha Shakritsi. So when there is Trika Prishta Katigraham, when the patient comes with low backache, some old patients, some 35, 40, 45 or chronic, this sitting job doing people, they have Katigraham. You ask them, they will be having good food and all, they'll be having lot of appetite, but motion satisfactorily it will not be there. In that avastha, Anuvasana is the best thing to be done. That is why Prakshina Kafapitta Trikaprishta Katigrahe Deeptagne Baddha Shakrita Prayunjita. So Kshina Kafapitta Drida Agni Purana Avastha Baddha Purishatva. If these are seen in any clinical condition, whether it is low backache or old age people, geriatric cases of any avastha, all those things, Anuvasanam can be done. So as I mentioned, indication in low backache, a 50-year-old female low backache, chronic, localized pain, no radiation, severe constipation. We need not make her undergo external, what you call it as Patra Potala Sveda, Kaya Seka, Shastika Vinda Sveda, etc. No, for her issue, Anuvasana Vasti with Tripalyadi, then followed by Sahajradi itself will do as such. So that is the indication. So usual spectrum of this aged females coming with low backache and severe constipation. If you admit, just go for local Abhyangushma Sveda and go for Anuvasana for 3 to 4 days, her issues will reduce. No need of going unnecessarily making this external therapies in the background. Okay. Then, towards as we are moving towards the end, the other indication of Nasyam where it can be done. Again, in any case, when we are prescribing Nasyam, Gaurava, Shirasa Shula, Vibhanda Indriyeshucha, Jirna Jware Ruchikaram Kuryadam Uthaya Virejanam. So, Gauravam and Shirashulam is the basic thing for 2 indication. And there is issues with Karmendriya, Jnanendriya Mala. Clear. So Karmendriya, Jnanendriya, there is Malatvam. We need to have Vimala Indritva. Vigata Mala of Indriyatvam. So all performance of Indriya is the best option. There is no Vibhandi issue. Whether it is Karmendriya or Jnanendriya, it is performing its activities in a very normal form. And Gaurava Shiras, Shula. So Gaurava of Shiras and Shirashula, both are the possibilities of Nasya. So any case, so when I am thinking of Nasya, but he is not having Gaurava, you have to think twice. Otherwise, it has to be just Patimarsha Nasya. So that is the indication. Now, when we have discussed about Snehapana, Vamana, Vireshana. So I quickly Kabe Mande, Vadapittotre, Snehapanam, Vamanam, Amashe Stitam, Virechanam, Pittashe Stitam. Niruhavasti, as I mentioned, Prakshina Kapapittasya, Anuvasanavasti, again Prakshina Kapapittasya, Trikaprishta Katigrahe. Niruhavasti is that avastha wherein Paripakveshu Dosheshu, Vamanam or Vireshanam cannot be done. In that avastha, Vasti with the Kshira can be given. Nasyam Gauravam Shirasa Shule. So this is the thing. Okay. Vibandheshu Indriyeshu cha. Now a little bit about Bahiparimarjana Chikitsa. Any Bahiparimarjana Chikitsa can be given in what are all the possibility? Abhyangam, Pradeham, Parishekam, Avagaham can be done. Vibhajya Shitoshna Kritam. But according to Avastha, you decide whether Shita Abhyangam or Ushna Abhyangam, Shita Pradeha or Ushna Pradeha, Shita Parisheka or Ushna Avagaha, that you have to understand. Tairashu Prashamam Yati, Bahir Margagato Jwaraha, Labhante Sukhamangani Balam. So if you are doing it with this Avastha, if somebody is very hot, you have to go for Shita Abhyanga. Somebody is very cool, you have to go for Ushna Abhyanga. So these are the possibilities that given. So you can go for a Bahiparimarjana Chikitsa in that Avastha, which is actually, but that Bahiparimarjana Chikitsa, the point is Shitoshna Krita. But where you can go? Jirne Jware. So Jwara Jirna Avastha. That means any disease actually in the chronic, it's not like any treatment started only you can go, initially only you can go for Abhyanga Pradeha Parisheka Avagahana. No, you have to go for Langdhana, Pachana, Yavagu, Tikta Rasa, etc. Then you can think of Abhyanga Pradeha Parisheka Avagaha, etc. Okay, that is the indication that he is giving. So the use of both Ushna and Shita Prayoga, according to the Samprapti of the Rogi, it has been specified over there. That is why Yatha Abhilasham Shitoshnam Vibhajya, it has been told. Okay. So as I mentioned, the positioning of external therapy. What has to be done first? Basically, Deha Santapa is the deciding factor. If any disease comes to my body, okay, for example, a joint pain had come to me. So the joint pain, I want to go for Bahiparimarjana Chikitsa. Why Bahiparimarjana Chikitsa? So Madhyama Roga Marga is involved. So, there is Vadakapadushti pain with cells. So I think of going for Enisa Uddharta Penasa Shwasa Kasa. Okay, Janga Parvasti Shulini. So definitely I'll think of Sveda as a possibility. Okay, I think of Ruksha Sveda. Then I see the body temperature. It is more hot. So I go for Ruksha Sveda. As I continue Ruksha Sveda, the heat in the body little comes down. But then as it is coming down and becoming normal, I can think of Shita Prayoga. Okay, in some cases when already there is Shita, I'll be going for Ushna Prayoga. Over a period when I touch the body and see, it will become more of Ushna. So, ultimately how the therapy is actually working in the Samprapti of the body is basically dependent upon how best we are touching the body and observing what's happening in the body. It's not just by seeing. Okay, we have to go touch the body and see what's happening. So, you really need a continuous medical officer, or if you're running a clinic, yourself have to be continuously monitoring what is this Kriya Krama doing to the patient's body, so that we can analyze whether we are moving in the right direction or not. Okay. So little bit some supportive points from Susruta in the same aspect, Jwara Chikitsa Sutra. In Vamana, Susruta says, Amasheste doshetu sa utklesha vamanam. Delhana supports, even we read commentaries, clinical points come up. Prillasa lala prasekadinam doshotklesha jneyaha. So how can we understand doshotklesha has happened? Prillasa, there we had seen Prillasa Praseka. He specifically speaks about Prillasa Lala Praseka, indication that Doshoklesha has happened. So he says, Avastha Visheshena Apatarpana Visheshamaha Amashesta Prillasa Lala Prasekadina. So Lala Prasekam can be seen as an indicator. Na Langhayen Marutaje Kshayaje Manase Tatha. Acharya Susruta directly give. Don't go for Langana. Charaka gives us a list, Shoka, Bhaya, Krodha, etc. In 3 as a surgeon, very specific short answers. No Langana in Marutaja, Shayaja, and Manasa. So any background of Vata, Shaya, Manasa. No Langana. Okay. Then about dosha pachanam, Susruta says, Anavasthita doshanam, Langanam dosha pachanam, Jwaragnam deepanam kamsha, Aruchi laghava karakam. So if Anavasthita dosha, don't go for the so-called Vamana Virechana. Okay, go for what? Langana, Deepana, Pachana. Same thing as told by Susruta. And Susruta directly says, when to introduce Brahmana, Srishta Maruta Vinmutra, Shitpipasa Saha Laghum, Prasanna Atmendriya, Shamam Naram Vidyat Sulankitam. If you could understand Samyak Lankita Lakshana he speaks it in Jwara context only. When there is proper evacuation of Srishta, Vitt and Maruta, Shit Pipasa Saha. Shuddha Pipasa, the same from Ashtanghadevam also. Vimalendriyata, Sargo Malana, Laghavam Ruchihi, Shuttrit Pipaso, Shuttrit Sahudayaha, Shuddha Hridayotkara Kanthata. So this is from Ashtanghadevam. Here he speaks about Shuddha Pipasa Saha, it has to come together. Laghutvam, Prasanna Atmendriya, Kshamam, feeling of little bit, you are becoming a little slim or something. Naram Vidyat Sula. In this avastha, when this avastha has come out, you can go for next Brahmana. He speaks about that. So Samyak Langana Lakshana Susruta gives in Jwara Chikitsa. Then for Virechana, what he gives? Yata Koshtanugaha Pakwa Vibadha Srotasa Malam Achirat Jwaratasyapi Tatyat Virechana. So Pakwa Mala, there is Vibandha Srotasa Mala. That's it. Okay. Shodhana needed even at OPD levels for a longer retrieval of symptoms. That's always I had found out because Acharya Susruta gives us Pakvo hi anirharato dosho dehe tishtan mahatyayam vishamam va jwaram kuryad abala vyapadevacha tasmad nirdharanam karyam doshanam vimanadvihi. So, if there is dosha in the body, even that is Pakwa, but it is anirdharana, it can cause many issues. So you have to understand even at the OPD level, Kriya Kramas, Shodhana has to be done. So, Prakarma Vamanam cha asya karyam asthapanam tatha virejanam tada kurya shirasasta virejanam. So the order he has given, Vamanam you can then follow by asthapan if needed, then virejanam, then nasyam. So you could see Karyam asthapanam tada, then virejanam. Vamanam, and it can be followed by asthapan or virejanam. It is not ki Vamanam, then you have to go for Asthapanam, then Virechanam. No. Vamanam, then according to Samprapti, if there is Pakvashega, the more Mala, Asthapanavasti can be given. If it is again, what you call it as more of Adonabhi, Pitta Virechanam can be done. But of course, once it is Jwara Samprapti, Kapha is definitely there in the background, and hence we must go for Vamana Karma in the first stage. Okay. So he gives us a thorough guideline by Susruta. Paline deyam vamanam shlaishmike jware pitta praye. In one sentence, pitta praye virekastu. Krayaha pradeshe. Saruje anilaje kare. Sav udavarta niruhanam. Kati prishta grahartasya deeptagnehe anuvasanam. Shuro gaurava shulagnam indriya prabodhanam kafa vipanne shirasi murda virechanam. Single line he has guided us. That's it. Okay. So any avastha shlaishmika vamana pitta praya vireka, but prashithilashe karyaha shithilashe. Ashayat must be having some shitalata with respect to dosha. Saruja anilaje karya along with udavarta niruhanam, deeptagni along with kati prishtagraharta anuvasanam, shiro gaurava indriya etc. Nasya. And in bedridden patients, Susruta says, Pavane tu urdhvam agate ruddham mutra purishaya gude vartim nidapayet. We usually prepare Vaishvanara varti. Vaishvanara, which is having lot of haritagi, that Vaishvanara is made into varti using sharkara, that is Buddha Panakam. You just make it heat and we can make a small varti. Use it as a phala varti. who are, this chronic like CRF patients or chronic bedridden patients, in that avastha it will be some nirharana will be coming. Then, in Jeerna Jwaram in the sense, any Samprapti which is chronic, these possibilities, Grita Abhyanga, Sveda, Lepana, Avasthasu, use it. The use of Grita Abhyanga, this Pahiparimarjana Chikitsa can be used, Acharya says. So I think towards the end, understanding the avastha is the most important thing in any samprapti. To understand that avastha, the guidelines told by the guidelines told in Jwara Chikitsa is the best option. So subtle observations, principles can guide us to improve our specificity and efficacy. Okay, so the journey of continuous observation analysis has to move on, documenting body's response to each procedure. That's very important. When we are making how that body is responding to that procedure, we need to continuously discuss. So mindfulness in clinical practice, which is actually the utmost thing needed in the prayoga of Kriyakrama. Okay, so with this I conclude, because with the principles of Jwara, maybe let us be more and more mindful about the clinical manifestations of the patients as well as our therapeutic interventions when we are doing. I'll end with this, open for discussion. Thank you.
Thank you, ma'am. It was a wonderful class, and thank you for sharing your clinical experience with us. You can ask your doubts to ma'am. If you have any doubts, you can ask your doubts. So, ma'am, can I ask your doubt?
Sure, yeah.
The patients before Yashti Madhu Gandha Vamana.
Before Yashti Madhu Vamana, Phanda Vamana.
Yeah.
Yeah, if it is Satya Vamana that we are planning, we do it in 2 to 3 hours. Like as I mentioned, if it's Utklishta, Samutklishta, Kapakaya, the patient is having Utklishta Avastha with Ullasa Praseka. If you are planning for Vamana tomorrow, today evening I can give some Utklishta Ahara like this Ushna, that Masha Payasam. That is the common thing that we do. On the day of Vamana morning, we make her undergo whole body Abhyangam for 10 to 15 minutes. Then steam chamber we make her sit. Give little Yavagu and then go for Yashti Phanta giving continuously. We do Yashti Phanta Vamana as Vasantika Vamana. There, according to the Koshta, we ask the patient or healthy volunteers to undergo this thing. What is that? Sadhya Sneha. Like with the Peya or with the Kshira, we ask them to have or either plain Grita, or if there is Pitta in the background, Pitta Grita for 2 to 3 days. We usually try to avoid or Pittotklesha aharas like achar and all, because that will cause some capillary rupture on the day of Vamana. And then we directly go for Yashti Phanta.
Okay, thank you, ma'am. Can we do Vaishwana Vasti Jwara patients?
Definitely. Vaishwana Vasti is actually done in Jwara patients. Vasti is done, as I mentioned, when there is Adona Abhigata Vikaras. So, if you just want to relieve constipation of the patient, also Vaishwana Vasti is a good choice. You have to think, if it is too krura, it is actually Ruksha Vasti. Okay. So, too krura Koshta, that will not work. You have to start with some Pipalyadi Anuvasta. Otherwise, it will work. In general, we do this Vaishwana Vasti in Jwara along with Amavata cases with fever. They will be having swelling and all in the knee, ankle and all. They will be having feverishness and all. In those cases, we do Vaishwana Vasti. So, it can be done, no issues.
Ma'am, question apart from Jwara, can we do Prathimarsha Nasya during cloudy season? Usually, we say during cloudy time, we cannot do Nasya. If it is Prathimarsha Nasya, also can we do during the day?
You see, in the Pratimarsha Kala that Acharya has mentioned, Pratimarsha actually Ajanma Maranam Shastam. From Janma to Marana, it has been told. It has not Nasya, but generally has been contraindicated Durdineva. So, in general, Durdina, even Pratimarsha Nasya will, what do you call it as, can create problem. Why? Because why Durdina is avoided? as I mentioned, Shiras is Kafasthana. When there is Shira, what is that? Kabha Dushti in the Shira, Shiro Gauravam, etc., we need to do Nasya. But when there is Megavaranam, there is Shitattvam in the atmosphere itself. So that will actually prevent from Kapha's evacuation. It will make Kapha clog and it will be causing Utkleshna. That is why Durdina is contraindicated for Nasya. So in those days, even Pratimarsha Nasya has to be better avoid. But if there is a clinical condition, if it has to be done in a sway, what we do practically is go for a lot of Svedana before and after Nasya. So that will do that thing.
Okay, thank you, ma'am, for just my personal doubt actually. So, participants, you can clear doubts from the group. You can ask your doubts. We will add ma'am's number to the group. Thank you again, ma'am. Thank you so much for your time.
Dr. Ramya,
Yeah.
thank you so much. I enjoyed how you created these case studies and tried to integrate it with the Jwara, even if they look so different, and the underlying cause of the Jwara, which is basically, you can correct me if I'm wrong, researchers are showing that anti-inflammatory condition is the base for all disorders. Like now they have come up with this statement, the medical doctors are talking about it. So your case studies and your presentation helped me understand that how important this correlation was, which acharyas have done that before and we never understood it in our education system. We separated it as malaria or kalajar or chikungunya, whatever. But Jwara is actually the samprapti under all these disorders which you talked about, and that is beautiful. I loved it. Thank you so much, Dr. Ramya.
Thank you.
Ma'am, one doubt, ma'am. Vasasvedam, that is clothes.
I'm unable to hear you.
Yeah, ma'am. Can you hear me?
Now, okay.
Okay, ma'am. Vasasvedam or Padasvedam indications, ma'am.
It is actually Tapasvedam, no? Tabo, Vasana, Phala, Hasta, Taladadihi. Vasana is Vasasvedam. Okay, that is cloth. So it is usually done in Sukumara patients. Okay, and in kids. So you just have to take this any of the cotton cloth or something, not nylon or polyester. It will not be having any heat retention. Heat retention materials have to be taken. So cotton cloth is taken and then it is made into a potali with another cloth, and then you just heat it and do it in this. So all this diffuse muscular pain cases, etc. In generally Sukumara patients, even in Pakshagada patients are very weak, but we need to go for some kind of Svedana, especially Madhyama Roga Marga, that arthritis spectrum wherein the patient is Abala, Sukumara, Alpasatva and all. Vasasveda is good one, and cost effective one to be advised to be practiced in the OPD level and all. So any area, especially the muscular area, not more in joint, neck, thigh, low back, this flanks, muscular areas, the best areas also.
Will we do that in kids, small kids?
Yeah, definitely, no issue. Small 3 year, there's 3 years, 4 years kids with when they have this respiratory issues, right? They'll be coming with continuous, as sneezing and all. But kids, small ones up to 1 year, we only go for Hastasvedam. 3-4 years and all, just mild Vasasvedam will be effective to be put on the chest area to relieve wheezing and all. And this, this COVID spectrum, when, they were having difficulty in breathing and all, definitely that was a possibility to be done at home and all. That was also giving good results. It was improving their saturation. I don't think that was improved because of this, but definitely their, breathing was much easier after that. That was the thing.
Ma'am, for Ushna Lebana in external Behi Padmarjan Silsa, for Ushna Lebana, what all will be used practically?
Yeah, Ushnalepana is generally done in Kapotara Avastha. Okay. So, neck pain, especially in the neck area, Rasnadi Churnam with the Jambira Swarasam is coming under Ushnalepana. And we only grind kaduga, mustard only. Okay. Some severe numbness cases when the patient, especially in the thigh area, this tensor fascial lata syndrome, and they have numbness and all, when we could see kapha vata in the background, we ask external lepanam of only sarshapa and maricha, because these are anagneya svedas also. Upanaham is a kind of anagneya sveda also, no? So dravyas which are having ushna guna property and dravyas which can be heated and then used, both these things can be used for ushna, done usually in the muscular areas and numbness kind of clinical situations.
And for Shiva Lebanam, practically, ma'am, other than Chandana, what will we use?
For normal sheetal, what you call it as Kachuradi Churnam is one common thing that we use. Kachuradi Churnam in rose water we use. When this pitta dominant headaches patients say, no? So they say in the afternoon I have this increase of pain and all. So Kachuradi Churnam is used. Chandanam is used. And then Ramacham is used. And then, Thailam. Chandanadi Thailam along with the Kachuradi Churnam, Ellum Nishadi Churnam with the Kshiram. All these things comes under Shitalepas.
Vaishnavasti up to how many days we can give, ma'am?
Depending upon the bala of the patient, 3 to 5 days continuously you can give. What usually adult dosage what we take is 300 ml Amrutotram Kashayam with 15 grams of Vaishwanaram. We can increase it up to 400 or 450